Assalamu alaikum and a very good evening to the brilliant panel of experts and my dear learned audience. I am Dr. Rawnok, working as a junior consultant of surgery, and my talk today is on clinico-demographic characteristics of CA15-3 biomarker positive recurrent breast carcinoma patients. Now, we all know that this conference is based on a burning issue in all worldwide, which is breast cancer. However, today I would also like to shine some light on the patients who are also suffering from recurrent breast carcinoma and how in our resource-constrained country we can utilize a biomarker such as CA15-3 for prognostic value for these patients. As we are all aware that recurrent breast cancer returns after completion of initial treatment, and it refers to occurrence of tumor in the breast after breast conservation therapy, in the chest wall after mastectomy. It can occur in the supraclavicular, infraclavicular, ipsilateral, and even parasternal lymph nodes. It can reoccur in the skin of the chest wall, in the reconstructed breast, and as distant metastasis in the lungs, bones, or even as a secondary carcinoma. As it is a very burning issue, therefore, it is of no surprise that recurrent breast cancer is the 5th cause of cancer-related deaths, with an estimated number of 23.3 million new cases worldwide. Therefore, advanced stage of the disease, poorly differentiated cancers are few of the major risk factors of recurrent breast carcinoma. And in most of the cases, it appears within the first 3 years after completion of treatment. Certain attributes like positive family history or BRCA1, BRCA2 gene mutation, in these attributes, the cancer recurrence rate is higher, and on average, 7% to 11% of women with early breast cancer experience local recurrence within the first 5 years after treatment. There have been several studies previously reported that cases with high-grade tumor, large tumor size, axillary nodal involvement, and negative hormone receptors have increased chance of recurrence. So what is serum cancer antigen 15-3? We all know there's an established prognostic marker for breast cancer patients. It is basically a glycoprotein that is secreted from the cells. And Kurebayashi et al. Have demonstrated that CA15-3 may have a role in monitoring the response to chemotherapy in breast cancer patient, which was reinforced by Duffy et al., who suggested that the most important role for CA15-3 is in monitoring therapy in patients with advanced and recurrent breast cancer. To sum it all up, the purpose of this study was to assess some of the clinico-demographic characteristics of those patients who had CA15-3 biomarker positive, especially in case of recurrent breast carcinoma patients. My study design was an observational type of analytic cross-sectional study, and it was conducted in the Department of Surgery and Department of Radiotherapy, Dhaka Medical College Hospital, Department of Surgical Oncology, National Institute of Cancer Research and Hospital from 2021 December to June 2022, roughly about 7 months. We included all those patients who presented with recurrent breast carcinoma after completion of primary treatment, that is after completion of adjuvant therapy, and patients with age of 18 years or above. And we excluded the patients who have not completed primary treatment and male patients. The sampling technique was purposive, and after obtaining written informed consent and approval of the ethical review committee, the patient's history was taken and clinical examination was done. Certain variables were analyzed, including age, type of surgery done prior, CA15-3 level during the follow-up, mode of recurrence, contraceptive history, menstrual history, and family history. And the cutoff value of CA15-3 was 30 unit per ml, which was estimated at the time of follow-up. A probability value of less than 0.05 was considered to be of statistical significance. After conducting this study, these were the results that we came up with. As you can see on the slide, about 56.9%, that is the largest percentage of women, belong to the age group of 41 to 50 years. And among 51 of our population, 51 patients, about 42 of them, that is 82.4%, had a raised level of CA15-3. Among the 51 patients, 29 of them, that is 56.9%, belong to the premenopausal group, and about 92.1% of them had invasive ductal carcinoma in their histopathology report. Other clinico-pathological characteristics had revealed that majority of the patients, that is 29.4% of the patients, had local recurrence, and right after that, 27.4% of patients had locoregional recurrence, that is in the breast and axillary lymph nodes. In terms of the previous surgery, majority of the patients, that is 35.3%, had done modified radical mastectomy followed by lumpectomy, for which the percentage was 31.3%. Now, when it comes to the statistical significance, we have concluded that menopausal status had basically no relation with the raising of the CA15-3 level. It did not reach any statistical significance. However, patients with invasive ductal carcinoma, as you can see here, did have a positive statistical significance, p-value of 0.009. And in terms of recurrence, locoregional recurrence had reached a statistical significance. And these were the patients we had seen that had positive family history. 39 of them had no family history, 76.5%, and about 44 of the patients had previous usage of oral contraceptive pill. To sum it all up, we can all acknowledge the fact that breast cancer recurrence is a significant problem for clinicians, and patients with early stage of the disease, that is stage 1 and 2, have a recurrence rate of 30%, and local recurrences after conserving therapy have been reported from 6 to 12% at 5 to 10 years of age, respectively. In this study, majority of the patients belong to the age of 41 to 50 years, and the mean age was 48.3, 9.6 years, which is similar to another study among 100 female patients whose mean age was 47.7 years. So more than half of the patients were diagnosed between the age of 40 to 60 years. Our study also shows that 42 patients out of 51 had a high level of CA15-3, and the relationship between CA15-3 with clinico-pathological characteristics showed that it was significantly higher in patients with invasive ductal carcinoma. It was also found to be high in patients with invasive lobular carcinoma. However, that did not reach any statistical significance. There was no association between CA15-3 levels and menopausal status, and all patients with locoregional recurrence had raised levels of CA15-3. Despite the diagnostic accuracy or the prognostic value of CA15-3 in this study, it must be acknowledged that there was a chance of bias as the sampling technique was purposive sampling. However, the impact of that has been reduced as our sample size was relatively small. Unaccounted confounding factors such as treatment variations and the lack of detailed primary tumor characteristics limited our study's applicability. Ladies and gentlemen, before I conclude, I would like to mention again that in this study, most of the women were in the middle age who are suffering from recurrent breast cancer. Invasive ductal carcinoma is the most common variant of recurrent breast cancer. Local recurrence is most common, followed by locoregional recurrence and chest wall recurrence, and modified radical mastectomy was the most common type of previous surgery per our study. I would like to thank the organizers of the 5th Bangladesh Breast Cancer Conference for giving me this opportunity to present my study. Thank you very much.